Hey everybody, Joel Hansen, Anybody Nutrition, nutrition for anybody and anybody. So today, update on my BPC 157 log, also hanging with the big pup Luna here. So, this covered day 13 to 18. Overall, I feel my knee has kind of plateaued. The benefit to my left patellar tendinopathy. First week, I saw a really exponential increase in benefit. That was my knee felt stronger. I was able to do a bit more. I did irritate it the second week, but now after not irritating it for a week or just over a week, and again, part of this could be my fault for irritating it, but I'm not seeing a similar increase. Now, my pec, which is my pec minor, potentially it's a tendinopathy or it's a tendon issue of some sort, which has been ongoing for about 4 years. I am seeing a continual benefit. So it is not plateaued as I feel my knee has, or if my knee has not plateaued, it is just the benefit is at such a gradual increase that I'm not noticing it as much. Again, I'm going to still continue treatment for, at this rate, about another 2 weeks. I was planning to do about 30 days, and there was a couple days where I missed the second injection, so I only did the one, versus 2 times a day, I only did it once. So I would have a little extra, so it would be probably about another 2 weeks, hoping for benefit. To give you kind of a idea of where I was, so I haven't been able to effectively exercise my lower body, or my left leg at least, since my injury, which is now about a year ago. So that being said, I haven't been able to effectively squat or deadlift or anything. I can get away with some hamstring curls or some hamstring exercises like straight leg deadlifts. Basically anything that doesn't involve knee flexion. And in all reality, over the year, despite the first, let's say, month, it's kind of gotten worse. The pain has gotten more severe, more limiting. So the BPC 157 at this point, it has not fixed it. When I irritated it was because I tried to train legs. So as far as that weight-bearing exercise, my knee is really no better. But what I saw with the benefit in the past 3 weeks, especially the first week, was my knee just felt stronger and sturdier. So I'm when I'm walking up the stairs, or I am doing something at the gym, or again, even just day to day, it felt stronger and sturdier. So again, that was the benefit I saw. And I'm not seeing much beyond that at this point. That being said, we have about another 2 weeks to go. Now, my right pec, the issue with that, so it's been on and off for 4 years. Essentially, I heard it in the gym. It never really, I did go to the doctor at the time, they just brushed me off. They never went for X-ray, MRI. So, despite having an actual diagnosis on my left knee, I don't have one on my right pec. It's just an ongoing issue. However, I've consulted a few, both the sports doctor I'm seeing, chiropractor, physio, and they kind of say it's probably a similar issue, tendinopathy of some sort. So that, I can train chest pretty well. I can't do flat bench anymore. But there's if I push myself really hard sometimes, or I just move a certain way, I can irritate it. And that's what's been going on now for 4 years. It gets 80 to 90% better, then I irritate it. However, since the BPC, it does feel again stronger in general. I'm getting less irritation doing exercises which sometimes might be on the cusp. Again, not 100% better, but just to kind of tell you and give you the idea of when I say better or benefit, what I mean. So, back to the dog. Overall, hoping for the next 2 weeks to be benefit. Again, the benefit to my left knee is kind of plateaued. My right pec, it does seem to be increasing, just a little less in smaller increments. Similarly, I do have an MRI set for my left knee, another one. So I had the ultrasound, and now I have an MRI, which is on January 14th. So that's coming up here in a week and a half. So that will be really interesting because I am going to get them to compare the actual MRI to the ultrasound and really assess if the tendinopathy has gotten any better. Because without that, it's just anecdotal, it's just my own personal feelings to whether the BPC 157 had any real effect. So at that, hope you enjoyed. Until next time, see you later.